I'm 23 years. I'm living in Castle. I'm HIV positive.
Ubaba wakho nuthakafuni nokumbona egcekeni lakwakho yazi ungaphika ukuthi sengilobolile mina kuloya muzi ubaba wakhona uthakafuni nokumbona egcekeni lakwakho uthi indodakazi yakhe yamthola ngephutha woba ngena mali batala ilobolile kuloya muzi we ilobolile kuloya muzi we abantu batala awe
Patients like Ntombikona are living longer, healthier lives. Being diagnosed as HIV positive is no longer a death sentence. And in the last 5 years alone, AIDS-related deaths have declined by 58% in South Africa. At the heart of this success are the foot soldiers of the health system, the nurses who have embraced their new roles as implementers of ARV treatment within primary health care and clinic facilities.
So we know that South Africa has more than 6 million people infected with HIV. And the research that's emerging is showing that earlier treatment is good, not just for people who are HIV infected, but to reduce transmission to those who are uninfected. And so in response to this, the strategy from the Department of Health has been to shift the task of looking after people on antiretroviral therapy to nurses, so that nurses can be skilled up to initiate and manage patients on antiretroviral therapy. So after nurses graduate, they then are trained in NEMAT or how to manage patients on antiretroviral therapy. This is very important and needs to be ongoing, but it does drain lots of resources. It takes nurses out of service. It disrupts service. And so the innovation that MEPI has introduced is to do this training at an undergraduate level, so that nurses exit university already having been trained in NEMAT. So they are ready to be mentored at their facility and can hit the ground running when it comes to this huge burden of HIV care for our millions of people who need antiretroviral therapy.
Led by Dr. Pillay and his team, facilitators run NEMAT trainings for both fourth-year undergraduate nursing students at UKZN and postgraduate primary healthcare and advanced midwifery nurses.
currently we are sitting, at a time where the minister has made a very clear mandate that we need to look at increasing the numbers of graduates that are being trained, and not just the numbers. Obviously, as a university, we want to look at improving on the quality. So it has been a great collaboration and a great impact that we have seen from MEPI, because if you look at one of the goals, some of the goals of the grant, they were very much aligned with the university's thinking, where the focus was on, strengthening undergraduate teaching, specifically, the healthcare personnel, and not just medical graduates, but also with a strong focus on nursing and pharmacy, improving the curriculum. And we have seen a lot of assistance and a lot of work being done by MEPI in those areas.
Every student nurse who is registered within the university gets to be trained, because it's essential. Because when they go to the service, they need to provide the service. What's the point of having somebody who's qualified but they don't possess enough knowledge? With this training, it equips our students so that when they go to the facility, they are able to actually manage somebody with HIV.
Having NIMAT also taught me that you can't always be more on one goal-directed person. You have to look at the patient holistically. So it has empowered me in a sense that I now, even though I work at a trauma unit, I'm able also to use my HIV and NIMAT knowledge to take care of the patient. For instance, you get a patient with a femur fracture coming straight from casualty to you. But those patients don't normally come to clinic. It happened by default that person was involved in an accident and they ended up on your unit. But when you doing your work as a nurse, you notice that no, other than the fracture, that patient has an STI. So I'm able to use my NIMAT knowledge to not just treat what I see, but also involve HIV and AIDS in everyday living of the patient. So it taught me to how do we say this? It taught me just to look at the patient holistically and not to be trauma orientated. I also give a little bit of HIV wherever I am.
I'm working in a district hospital. It's a small rural hospital, and I've been in neonatal nursery for the whole year. And before NIMAT, when I was still a student, I worked in nursery before. And with the prophylaxis, the mothers would ask me, what is this prophylaxis for? And I couldn't answer them. But now that I am NIMAT trained, I can answer the mothers and tell them that this is what the prophylaxis is used for. Because something that I found common is the mothers seem to think that we're giving their children prophylaxis because their children are infected. So you're able to ease their minds when you tell them and explain to them what the prophylaxis is used for, and they're more at ease and they trust you more and they're more willing to comply with the treatments. So that is what I've noticed, and I feel that it strengthens the relationship with the patients because they are able to trust you more, and you as a nurse as well become more confident because you know your information.
With the course, I've noticed that I feel now empowered and confident, to basically approach these patients with dignity that I probably once didn't have because I was scared to actually approach these patients before, I would obviously think that, maybe if I touch them or if a little bit of their blood spilled into my finger or something that, oh no, I will probably, get the infection. With the NIMAT course, it helped me to sort of move away and dispel of all of those myths.
These women that are pregnant, when they come to the clinic, they're being seen by the nurses. Those that are NIMAT trained, they just start straight away to initiate treatment. They don't send these patients to the hospital. This place, I must say, it's a poverty-stricken place, so they don't have money. If you refer them to they don't go. So now it's very economical for those that are getting their treatment here. When they don't come, we do fast track them because we've got their addresses. We phone them. If we don't find their addresses, we send people to go and fetch them so as we can initiate as much as possible. So treatment has a very, very, very good impact to our patients, and they are living long. They are no longer dying. Our mortality rate has gone down due to this initiation of ARVs. People are dying. Now, no.
With treatment well established, the question now being asked is what's the next chapter for our scientific researchers and academics who have, against all odds, continued the fight against what was once regarded as the world's most dreaded disease.
As we approach World AIDS Day 2015, we need to take a note of the international move towards eradication. And it needs to be something that we adopt. Eradication of the epidemic, eradication of stigma, eradication of new infections. And I think that the greatest legacy of MEPI is that we've laid the foundation for this new strategy. We've laid the foundation by empowering teachers, we've laid the foundation by empowering students, and we've laid the foundation by setting a path within UKZN towards greater HIV content in both undergraduate and postgraduate curricula.
ubaba wakho nuthi akafuni nokungibona egcekeni lakwakhe yazi ungaphika ukuthi sengilobolile mina Hloya.
We've made a huge difference there. We had a vertical transmission rate of 33% in 1994 when we first started looking at the problem. Currently, you know that we are down to less than 2%, but we can do even better. So we need to make sure that more mums are encouraged to take up the treatment available and care available at antenatal clinics.
There can be no doubt that South Africa, and KwaZulu-Natal in particular as the epicenter of the epidemic, has achieved what many thought to be impossible. And while the cure for AIDS remains elusive, it's no longer unrealistic.
We've accomplished in some unprecedented way historically an amazing amount in our responses to the epidemic, and a lot of that has been about science innovation, and that has given us hope about epidemic control. But that we have to continue to innovate, we have to find methods for women, we have to find a vaccine, we have to find a cure. But even as we continue our efforts there, these accomplishments has come because of important partnerships, important investments that have been made. South Africa bears a disproportionate burden of infection. We have valued these partnerships, we have valued these investments. We're far from seeing the end of the epidemic, and we value the continued partnership, support and investments until we can really say we have epidemic control, we have a vaccine, we have a cure, we have methods for women. I think we have to continue in this path that we've started, this journey, and ensure that we really realize the goal of an AIDS-free generation, and really call it that we now have this, we can say this epidemic has ended.
For those like Ntombikona, it's that determination, hope, and belief which drives the human spirit and the will to continue moving towards an AIDS-free generation in our lifetime.
I'm Connor, I'm HIV positive, I'm a human being same like you.
Ubaba wakho nuthakafuni nokumbona eceleni lakwakho. Yazi ungaphika ukuthi sengilobolile mina Hloya Musa. Ubaba wakhona uthakafuni nokumbona eceleni lakwakho. Uthi indodakazi yakhe yangithola ngephutha. Woba ngena mali badala ngami. Ngilobolile kuloya muzi we. Ngilobolile kuloya muzi we. Abantu badala ngami. Hawe. Hawe. Wambona kanjani?